The topic of this meeting is very, very important because it is a very practical one. Every gynecologist in everyday practice have to deal with this topic in its everyday practice. I mean, every gynecologist has to cure the diseases, have to treat, have to remove the disease by surgery, but at the same time, he has to preserve the function of the uterus, of the ovaries, the function of the nerves, the function of the bowel and the urinary tract that are very close to the genital tract system. So it is a very important topic, very actual, very current topic. There is an increasing request from the patients to have preserved their organ when they go to surgery. They request not to undergo to hysterectomy or not to undergo an ovariectomy. So they ask for some other procedure to preserve the organs till and after the menopause. So we have to answer this question, and this is maybe a very good occasion to have an answer. The newer topics in this Congress are, for instance, the neuropelviology. In the recent year, we have about the physiology and the anatomy of the pelvis nerves, the neuropelviology, and then we have learned to respect the nerves. To respect the nerve, that is very important in order to respect the function of the organ, of course. And the second point is to preserve fertility for patients with gynecological cancer. Of course, it's not possible for all patients, but for young patients with no very advanced cancer, we can do it for cervical cancer, for endometrial cancer, and even for ovarian cancer. And the last point, very important, is for the very young patient or that have some oncological pathologies. I mean lymphoma, I mean breast cancer, I mean cancer of the bone. They may undergo to ovarian cryopreservation. So we take a piece of ovarian tissue, we cryopreserve it, and after healing we may make an homologous transplantation in the same patient in order to allow her to have an ovary with reproductive function and with hormonal functions. And it is very important.